Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Then in the bladder, atropine effect on bladder, it decreases the intravesical pressure and it increases the bladder storage capacity is increased. Then the main drug for bladder effect is tolteridone. Tolteridone is most selective for urinary bladder and it is selective for M3. Thus this tolteridone is the drug of choice for irritable bladder syndrome. And it is we can also use oxybutynin, but this oxybutynin is less selective and it causes, so oxybutynin can also be used, but oxybutynin is less selective when compared to uh, tolteridone, and this causes lots of cholinergic side effects. That is, anticholinergic side effects are more common in oxybutynin. But still, despite of these anticholinergic side effects, this oxybutynin is used as drug of choice for urge incontinence. Then, if you see the drug pipenzolate can be used for infantile colic, whereas the drug flavoxate is used for ureteric colic.
thank you and thank you for watching.